I'm Pat and I'm an oral health promoter. We're going to discuss oral care for people with disabilities. If their dexterity is compromised, we may need to look at adapting toothbrushing techniques and or adapting toothbrushes to help people remain independent when toothbrushing.
There are lots of ways in which we can adapt toothbrushes to help someone remain independent with mouth care. Electric toothbrushes have large handles, making them easier to grip, and they carry out the mechanical action of brushing, which is helpful for those with limited arm strength and dexterity problems. There are also specialist manual brushes available with multiple heads that clean all tooth surfaces at once. They are great for when opportunity is limited, such as cooperation issues or difficulties in keeping the mouth open for long periods. Normal brushes can be adapted with a cloth and bands, pipe lagging, or handle grips to allow a person to hold the brush more easily. Brush handles can also be heated and then bent to adjust the position of the head. Mouth props and finger guards are good to allow someone to bite on when they can't keep their mouth open for long periods. They're also great to prevent you from getting bitten. It's down to personal preference as to whether a manual or electric brush should be used. The important element is that teeth are brushed thoroughly twice a day for at least 2 minutes, in the morning and last thing at night. A fluoride toothpaste should be used. Fluoride helps to prevent and reduce the risks of tooth decay. Everyone over the age of 3 should use a pea-sized amount. To control gum disease, it is the mechanical action of brushing for effective plaque removal that is important. Some toothpastes contain ingredients that help to reduce plaque, gingivitis and bleeding gums. Mouthwashes should be used at a separate time to toothbrushing, and mouths should not be rinsed after brushing. We should spit the excess toothpaste out as the fluoride needs to stay on the teeth. It's really important when giving mouth care to someone else that we think about communication. Often staff can find it quite difficult to brush someone else's teeth. It's really important to explain throughout what you are doing and make the person feel comfortable. We need to consider all aspects of communication, not just the verbal. Think about your tone of voice, the posture and gestures that you make, your facial expressions and body language. Use simple language, avoid jargon or medical terminology. Short, appropriate sentences. The communication should be two-way, encourage responses and communication. Ask questions and feedback, ensure understanding, and use active listening skills. All forms of communication are valuable. It helps to put a person at ease and can build relationships, and good rapport with the person can help make difficult tasks easier. Tracy and Pat, our oral health promoters, will now demonstrate how to brush someone else's teeth.
Hi Tracy, I'm Pat and I'm here this afternoon and we're going to do some toothbrushing, is that okay? Okay, what I'm going to ask you to do is just rest your head on me and ask you to open wide. And when you've got the head resting on you, it's very easy to give you, it's much better, it gives you better vision and better access to the mouth. Okay, are we all right there? What I'm going to do now, I'm going to put some toothpaste on. We're going to use a pea-sized amount. Are you feeling okay, Tracy? Keep your head resting on me, and I'm going to ask you to open wide. And we're going to start by brushing the teeth at the bottom. I'm going to start by brushing these teeth that we chew our food with, the biting surfaces. Gives them a really, really good scrub. Once we've done that, we're going to angle our brush and we're going to brush round and round and round in circles, working from one side all the way round and starting and doing the other side, brushing the gums as well as the teeth. This is a better way of removing any plaque and food that I may have got caught in the teeth and around the gums. I'm going to turn our brush long ways. I'm going to brush in the inside where our tongue goes, and again brushing the inside of our teeth and gums. brushing round and round in circles. Okay, okay, all right. Am I okay to continue?
That's fine.
Okay, then I'm going to start on the top teeth. We'll start again by brushing these teeth on the biting surfaces, the teeth that we chew our food with. Okay, giving them a good scrub. Lots of little nooks and crannies where the plaque can grow. And I'm going to turn our brush angled again and brush round and round in circles, swapping the toothbrush over and brushing round from one side to the other. Okay, then we need to open wide again. Turn our brush long ways and brush on the inside of our teeth, behind the front teeth. And then angle our toothbrush again, brush round and round in circles on the inside of the teeth and then the other side. Okay, and then we will ask Tracy if she can spit any excess of the toothpaste out.